Do you feel like no matter how much you study, after doing endless role plays, AMC exam still feels like a mystery? Well, I have been there. I exactly know how it feels when you give your best, put in maximum effort and still feel stuck. After attempting this exam a few times, I finally realized what mistakes I was making and what I should have done right from the beginning. In this video, I'll share those lessons with you so that you can save your time, your energy and your money. So hello everyone, I'm Surbhi. I have completed my AMC exams and in this video, we'll talk about everything related to AMC Clinical. From booking your exam dates to preparation strategies, resources, and then finally I'll share how I prepared for AMC Clinical exam. Let's start with booking. Because honestly, getting a slot is as difficult as exam itself. Think of it like trying to grab a concert ticket. Here are a few tips that work for me. Be ready 9 AM sharp Sydney, Australia time with a very good internet. Read your AMC guide beforehand and log into your AMC portal on time, as well as keep your payment method ready. Make sure which cards they are accepting. Because during my time, debit card didn't work and I nearly lost my chance. Luckily, a friend helped me out at the end moment. Also shortlist 3 or 4 dates and stay flexible, because if you hesitate, you will miss your chance and slots will disappear in seconds. Also remember, you cannot cancel your exam or you cannot postpone your exam unless and until there's a very serious genuine reason. So think twice before confirming your exam date and be realistic about your preparation timeline before you book your exam. Let's talk about exam itself. This is face-to-face exam and held in Melbourne. It lasts about 3 hours and 20 minutes. It has 20 stations in total, 16-hour performance station out of 2-hour pilot stations, which don't count towards your score. But you don't know which ones are your pilot stations, so give your 100% in all of your cases. You will get 4 rest stations where you can drink water or you can use washroom if you want. Now each of your stations runs for 10 minutes. 2 minutes outside the room to read the question and 8 minutes inside the room for performance. Now when you are outside the room and reading your question, think about your approach, your structure and possible differential diagnosis. Don't lock any specific diagnosis even before enter the room, because cases can change and examiner will easily pick up if you are forcing any pre-decided diagnosis. When you enter the room, examiner will check your ID, they'll introduce yourself to the patient. You will get 2 copies of your question, one on the paper and one on the screen. You will also get few blank paper and a pen if you want to jot down something while taking history. Also sometimes examiner will give you a mini bell to move the next task, but don't expect it in all the cases. And when your final 8-minute bell will ring, stop immediately. Don't waste your time or don't squeeze any extra words and move to your next station, because your 2-minute reading time of your next station has already started. The big question is when you should start preparing. Honestly, it depends on your style. Some people need 6 to 8 months if they are studying full time. For me, it took almost a year just to understand what this exam is about and what all resources I should use. Also, I'm a person who needs few revision before I feel confident. So if you are like me, don't worry if it feels slow. This preparation is very personal, so don't compare yourself with others. And the important thing is start early, revise often, and then build your confidence step by step. The AMC Clinical tests you across many subjects. Make sure you cover your medicine cases, physical examination head to toe, counseling cases, obstetric and gynecology, pediatric and psychiatry cases. All of these subjects and each topic needs both knowledge and structured practice. I strongly recommend taking coaching for AMC Clinical exam. Personally, I did Dr. Amin's workshop. I truly believe that was the best investment of time and money. Once you are done with all of your workshops and making your notes, keep revising it, practice it thoroughly. Drill those structures until it becomes natural. Honestly, I practiced this so many times that my jaw was hurting. Yes, it requires that amount of hard work, but it's all worth it at the end. Now let's talk about role play. For medicine, obstetric and gynecology, pediatric, psychiatry and counseling cases, you can do role plays like 2 to 3 times a week for a couple of hours and focus on your key points, your structure, time management, as well as differential diagnosis. But for physical examination, role plays are very, very essential. Practice PE every single day with your study partner. Those daily practice will sharpen your flow and confidence. Studying alone for this exam is very tough, so you can find study partner for this exam preparation. If you are taking any coaching, you can find your study partner from there. Otherwise, on Telegram, there are few groups. You can definitely find some study partner from the Telegram group. Ideally, find someone nearby because this exam is face to face, so practice in person makes a huge difference for body language, eye contact, as well as time management. Let's talk about mock tests. Mock tests are not very essential for AMC clinical exam, but I do recommend taking one mock test just to manage your anxiety and time. But if you know your weaknesses and you are already fixing them, then I think it's okay to skip your mock test. Here's how I prepared for my AMC clinical exam. I attended all of Dr. Ami's workshop and made a detailed notes. I was keep revising my notes and I was practicing in front of the mirror with a timer. I also did few role plays with my study partner once or twice in a week, and we also practiced physical examination every day. In my last 1 month, I met my study partner every day in the library. We went through all the clusters and we practiced physical examination system by system. For example, if we are studying CNS today, we'll also finish physical examination of CNS today itself. That way you can cover 2 topics in a 1 day. I also made a small notes of key points and differential diagnosis. So in my final week, I just focused on the key points, differential diagnosis, critical error, and physical examination. I am emphasizing a lot on physical examination because you get your 3 or 4 stations of PE, sometimes 5. So if you go really well in your PE cases, it will boost your score. Here's something I want to tell you all, that yes, this exam is tough, but it's not impossible. With the right approach and strategic preparation, you can pass it too. Even if you don't pass it in your first try, you will gain so much knowledge that it will genuinely help you working in Australian healthcare system. So nothing go waste. Keep trying, keep practicing, keep revising, and remember, in the end, it's all worth it. If you like my video, share it with your friends who are preparing for AMC clinical exam. Also subscribe to my channel for more videos related to AMC, MCQ and clinical exam. Thank you for watching. All the very best for your preparation.